Thank you, Shoshana, and welcome everybody to the first technical assistance call of our program year, which started on October 1st. We're so glad you could join us today. Before we get into our main event on general supervision, I wanted to give Kim Himes of our data implementation team an opportunity to share some important information with you. Kim?
Great. Thank you so much, Greg. Before we get started today, we just wanted to take this opportunity to let all the eMaps users out there know that there will be a new login process that you will be required to follow. Essentially, eMaps is moving to a multi-factor authentication login process, and so you will need to update your information accordingly. On September 19th, PSC sent out an email with detailed instructions, and so we would really encourage you to go back and read that email and follow the instructions that were included, and of course reach out to PSC if you have any questions or run into any issues. We've included the link to create your new login.gov account, which is part of this process, and that will be in the chat. But again, for the full instructions, you can please refer to that email. We did want to flag for you that the login.gov account must be set up by October 27th. So just wanted to make sure that we took this opportunity, given that that's in a couple of weeks, to just flag this information for you while we were together. So thank you so much for paying close attention to this this new login process. And again, if you have any questions, of course, reach out to PSC or any of your OSEP state leads. And with that important information, I will hand it back to Greg.
Thank you so much, Kim. As most of you likely know, this summer, OSEP released its comprehensive general supervision guidance document. I hope you've had a chance to take a look at it. There certainly is a lot in there. The guidance is intended to ensure and strengthen the rights and protections guaranteed to children with disabilities and their families under the IDEA. The guidance and a Dear Colleague letter, which accompanied it, address IDEA's general supervision requirement, which necessitates states monitor their local education agencies as required by Part B, and early intervention service programs and providers as required by Part C, again, to ensure children with disabilities and their families access their rights under IDEA. The guidance incorporates long-standing policy and supersedes 3 previously issued guidance documents. Certainly one of the benefits of this is it puts all of the requirements under one cover. So one of the things that we have incorporated and superseded is the frequently asked questions regarding identification and correction of noncompliance, which came out in 2008. Second one is OSEP Memorandum 0902, which I think a lot of you are familiar with, which is also on reporting correction of noncompliance. And then finally, a document that came out a year later in 2009, questions and answers on monitoring, technical assistance, and enforcement. This current guidance, this recently released guidance, incorporates other longstanding interpretations that are reflected in a number of different places in OSEP's monitoring reports, in the determination process, policy letters, and grant documentation. And we address common questions that OSEP has received from parents, states, local programs, and other stakeholders. So without any further ado, I'm going to turn it over to our team who will be presenting today. And I believe Kate, there she is. Kate will be leading us off.
Thank you so much, Greg, and welcome. Thank you for joining us on today's call. I'm Kate Moran, and I'm excited to be here with you today. This month, we wanted to follow up to our leadership conference presentation and review some of the key concepts within OSEP's guidance document, State General Supervision Responsibilities under IDEA Part B and C of the IDEA, Q&A 2301. With me on today's call is Jeanette Guerra, Shannon O'Neill, and Kim Himes, and Travis Bryant. Next slide, please. On today's call, we will revisit why OSEP is issuing this guidance and provide a general overview of the document. In addition, we will spend time discussing in more detail the clarified and expanded positions included in QA 2301. Finally, we will highlight some of the OSEP-funded TA Center resources currently posted and upcoming events. Next slide, please. On this slide, you will find the links to both the Dear Colleague letter and OSEP's General Supervision Guidance, commonly referred to now as QA 2301. Next slide, please. In the words of our OSEP director, through conversations with states, consider this guidance to be a floor plan for evaluating compliance with IDEA, helping to establish the foundation and floor of opportunity on which states can build to new heights, ensuring improved results and outcomes for infants, toddlers, children, and youth with disabilities and their families. Next slide, please. Under the Results-Driven Accountability System, RDA, reasonably designed general supervision systems ensure that all children with disabilities have available to them a free, appropriate public education that emphasizes special education and related services, and early intervention services to infants and toddlers with disabilities and their families, which ultimately prepares them for further education, employment, and independent living. Next slide, please. There are a few different reasons why this guidance was needed and what questions OSEP believes this guidance will address. The first and most important reason is that ultimately this guidance will ensure the rights guaranteed under IDEA to infants, toddlers, and children with disabilities and their families are protected. Over the years, OSEP has received multiple requests from a diverse group of stakeholders asking the department for updated and consolidated guidance interpreting the general supervision requirements for states. Second, we believe QA 2301 provides states with accessible and actionable information necessary to timely identify and correct noncompliance, and reaffirms expectations across states to ensure consistency with the implementation of IDEA. Next, this guidance, as Greg mentioned, supersedes some of our old guidance related to general supervision, last issued in 2008. In addition to consolidating guidance from multiple sources, such as monitoring letters and reports, the determination process, policy letters, and grant documentation. And finally, QA 2301 addresses clarified or expanded positions, reflecting issues that have been identified during OSEP's monitoring and common questions that OSEP has received from states and other stakeholders, including through our OSEP-funded TA centers. Next slide. QA 2301 provides an overview of general supervision and is divided into the 5 sections that you see here on this slide. State general supervision responsibilities, identification and correction of noncompliance, SPP-APR, state annual determinations, and state enforcement through determinations and other methods. Next slide, please. A state's investment in establishing and implementing a robust general supervision system may require some examination and evaluation of the various ways in which a state engages in activities which evaluate an LEA's or EIS programs or providers' compliance with IDEA. Understanding that a state's general supervision system occurs across different components and at various times throughout the year. To be effective, These components should operate as an integrated system to connect, articulate, and inform one another. In this graphic, you can see that across the various components, they each include specific areas of analysis. However, when conducting a state's integrated monitoring activities, these same components often cross over and are included as information when evaluating the LEAs or EIS programs in your state through annual or cyclical monitoring. General supervision is often not a straight line, as you can see on this slide, but our hope is that QA 2301 will provide states points to consider across all of the different activities they engage in to ensure compliance with IDEA. Next slide, please. QA 2301 further clarifies or expands on longstanding OSEP positions and policies. Today, we will discuss in more detail credible allegations, a state cycle for monitoring, expectations related to the timely issuance of findings of noncompliance, and the verification of correction. Next slide, please. Finally, we will circle back to our puzzle pieces. As presented first in 2004, a reasonably designed general supervision system should include 8 integrated components. While each state has the flexibility to develop its own model of general supervision and may elect to address the underlying federal requirements in other ways, it is OSEP's longstanding presumption that an effective system of general supervision used to monitor LEAs or EIS programs or providers would, at a minimum, include these 8 components. And now I will turn it over to Jeanette Guerra, who will discuss in further detail some of the clarified and expanded positions in Section A. Jeanette?
Thank you, Kate. Good afternoon, everyone. As Kate said, we're going to begin reviewing each section of the guidance by highlighting questions or topics that have been brought forth to OSEP so far. We'll review the key concepts, discuss some of the components of each section, and then discuss those specific questions. And so a key takeaway from the first section A is monitoring the implementation of IDEA will improve results and functional outcomes for infants, toddlers, and children with disabilities and their families. You've heard this, you heard Kate say it, and it's a theme you'll hear often. Next slide, please. Section A of the guidance provides detailed information about each of the 8 components of a reasonably designed general supervision system. Questions and answers in this section include a deeper look at integrated monitoring, including descriptions and examples, information regarding the collection and use of data systems, a clear explanation and description of a state's fiscal management responsibilities for ensuring compliance with the OMB uniform guidance and IDEA requirements, and the role the information from how a state from a state's dispute resolution system plays in general supervision systems, such as how the state may be able to identify patterns within its due process and state complaints and decisions that may suggest systemic noncompliance by one or more LEAs or EIS programs. Also in Section A, you'll find 2 additional priority areas discussed in further detail related to child find and significant disproportionality. We're going to talk about some of these as they specifically relate to Part C and Part B monitoring responsibilities in subsequent slides. Next slide, please. So today I want to draw your attention within Section A of the guidance to the expectations for the local monitoring of LEAs or EIS programs or providers to meet the requirements of IDEA. Again, and as you've already heard, the focus is on improving results and outcomes for infants, toddlers, and children with disabilities. For this first section, let's review a few of the key expectations for monitoring that are applicable to both Part C and B. The effectiveness of general supervision relies on the use of a data system that collects and reports valid and reliable data. So states need to consider how and how often that data will be reviewed and used to identify noncompliance. The state's general supervision system should ensure that the data collected through the data system is reviewed at regular intervals, such as monthly, quarterly, or annually. The monitoring policies cannot allow, though, for the delay of identification of noncompliance until the submission of SPP APR data or the annual determination process. Integrated monitoring activities are at the crux of an effective general supervision system. Some of the examples provided in the answer to question A3 include conducting interviews and listening sessions with staff, parents of children with disabilities, the children with disabilities, reviewing local policies and procedures, reviewing information collected through the state's data system, examining and evaluating performance and results data specific to IDEA, analyzing assessment data, evaluating fiscal procedures, and reviewing information from the dispute resolution system. These activities combined create the process for examining the LEA or EIS program or provider's implementation of IDEA. Now, we recognize that because each state's general supervision system will be uniquely designed, the integrated monitoring activities will also be designed to align with that as well. Regardless, and in alignment with the administration's focus on equity, states should be evaluating the equitable implementation of IDEA in local programs by examining policies, procedures, and practices. Finally, states should monitor all LEAs or EIS programs or providers within a reasonable period of time and at least once within the 6-year period of the SPP APR cycle. However, if there are data or other information available that indicates an area of concern, a state should consider whether more frequent or targeted monitoring outside of the normal monitoring cycle is necessary, in which case the monitoring would typically be more limited in scope to address the emerging or new issues. States are encouraged to make the results of its monitoring cycle available to the public. So now let's move on and talk about the specific expectations for monitoring Part C programs. Again, we're reminded of the overall goal for each state's Part C general supervision system to improve early intervention results and functional outcomes for infants and toddlers with disabilities and their families. Under Part C, each state system must include a single responsibility in the designated lead agency or as established within the state that is responsible for, among other things, monitoring programs and activities used by the state to carry out IDEA Part C, whether or not the programs or activities are administered by agencies, institutions, organizations, and EIS providers are receiving assistance under IDEA Part C. There are often questions about who the Part C lead agency should be monitoring. Is it a program or individual providers? The state lead agency has the flexibility to set up a structure to ensure the implementation of Part C in a variety of ways and is often dependent upon how the funding is dispersed or managed within the state. Thus, they can monitor accordingly. Some states may monitor the programs or districts or regions or health offices, for example, that oversee the various providers, or in states that may have providers that are independent of a regional office or district, the state would monitor the provider. And so if states have questions about how to evaluate which programs or providers they need to monitor during the 6-year cycle, OSEP is available to discuss in addition to our OSEP TA funded TA centers. Under the IDEA, the lead agency must monitor each EIS program or provider in each of the priority items listed on the slide: early intervention services in the natural environment, child find, general supervision, including effective monitoring, system of transition services, use of resolution systems, and mediation. The child find requirements include identifying specific subpopulations that may need additional coordination and collaboration for effective child find practices. In Part C, that includes Native American infants and toddlers residing on reservations, infants and toddlers who are homeless in foster care and wards of the state, infants and toddlers identified under CAPTA, the Child Abuse Prevention and Treatment Act, in substantiated cases of abuse or neglect, and at-risk infants and toddlers who have been identified as directly affected by illegal substance abuse or withdrawal symptoms resulting from prenatal drug exposure. Within the Child Find system, states should examine equity issues that can exist, including significant disparities between different race and ethnicity populations, low and high income families, and geographic locations, such as between urban and rural areas. Next slide, please. Now we'll move on to discussing some of the expectations for local monitoring in Part B. And again, keeping in mind that the overarching goal of the Part B general supervision system is to improve educational results and functional outcomes for children with disabilities. State education agencies are responsible for the general supervision of all educational programs for children with disabilities administered within the state, including each educational program administered by any other state or local agency, but not including elementary schools and secondary schools for Indian children operated or funded by the Secretary of the Interior. This includes Section 619 preschool programs, public charter schools, children with disabilities residing in nursing homes, and educational programs in juvenile and adult correctional facilities. Generally, SEAs monitor the subrecipients of IDEA funds, which can include LEAs, public charter school LEAs, and programs operated by other state agencies, such as correctional agencies. The subrecipients, in turn, are responsible for the general supervision of schools or programs within their jurisdiction. Similar to Part C under IDEA, the SEA must monitor each LEA in each of the priority items identified on the slide: provision of FAPE in the LRE, general supervision, including effective monitoring, child find, system of transition services, use of resolution meetings, mediation, and disproportionate representation. IDEA requires states to have child find policies and procedures that ensure all children with disabilities, regardless of the severity, are identified, located, and evaluated, and again, include subpopulations that may require increased coordination to be effective. In Part B, examples might include children who are experiencing homelessness or wards of the state, are highly mobile, including migratory and military children, or are English learners. And here too, states should be looking for and examining any equity issues. This guidance also references some previously provided extensive guidance on significant disproportionality. And so states are required to use a standard methodology to determine if significant disproportionality based on race and ethnicity is occurring in the state and its LEAs. When an LEA is identified with significant disproportionality, the regulations require the state to provide for the review and, if appropriate, revisions of policies, procedures, and practices it identifies as contributing to the significant disproportionality, including any policy, procedure, or practice that results in a failure to identify or the inappropriate identification of members of a racial or ethnic group. Now, if an LEA is identified with significant disproportionality, the state must require the LEA to set aside a total of 15% of its IDEA Part B funds to provide comprehensive coordinated early intervening services, or CCEIS, to address the factors contributing to the significant disproportionality. States must monitor those LEAs to ensure the required amount of funds were used to address factors contributing to the significant disproportionality. Also, as part of the state's monitoring activities, it should monitor for and address any implementation challenges that may result from confusion about the interplay between federal and state laws, including those challenges that may arise from the examination of data disaggregated by race and ethnicity. So question A9 and the reference guidance provide more detailed information on this topic. For now, I'm going to turn it over to my colleague, Shannon O'Neill.
Thank you, Jeanette. All right, so we will now move into our next section, But first, let's review the key concept from this section. Identifying and correcting noncompliance is critical to improving early intervention and special education. As we move into section B of the guidance, we will focus our attention on how the correction of noncompliance specifically relates to improving results in early intervention and special education. Next slide, please. Section B of this guidance, Identification and Correction of Noncompliance, reviews information included in previous guidance and clarifies expectations. This is particularly the case as we look at areas of concern and credible allegations as described in questions B1, B2, and B3. We will spend more time talking through this particular topic in the next few slides. Additionally, this section reaffirms the requirements related to the timely identification of noncompliance, as well as the correction of noncompliance for both systemic and child-specific noncompliance. Questions B11 and B12 review the requirements of utilizing pre-finding corrections, which, as you may remember, have the same verification of correction requirements to demonstrate that the noncompliance has been corrected prior to the state issuing a finding. The last concept I want to highlight in this section discusses what the state should consider if an LEA or EIS program has longstanding noncompliance with the IDEA requirements. Again, thinking back to the key concept we reviewed on the previous slide, failure to comply with IDEA could have serious implications for ensuring the provision of FAPE for children with disabilities and the receipt of appropriate early intervention services for infants and toddlers with disabilities and their families. This ultimately could impact further education, employment, and independent living outcomes, which this guidance seeks to impact for all infants, toddlers, and children with disabilities from ages birth through 21. Next slide, please, Shoshana. All right, so we'll now move on to reviewing question B1. This is one of the components of the guidance that many of you asked about at either the OSEP Leadership Conference or in follow-up conversations with your state leads. The question asks, what is an area of concern? We recognize that IDEA does not define this. However, it has been used in OSEP's practice to mean a credible allegation regarding an IDEA policy, procedure, practice, or other requirement that raises one or more potential implementation or compliance issues if confirmed true. Since the release of QA 2301, there have been a lot of questions regarding the phrase credible allegation, so we want to provide a bit more clarification. When an allegation is credible, the state has awareness and information indicating that the allegation is more likely true than not. So for that reason, OSEP will be using area of concern and credible allegation interchangeably to mean the same thing as defined here, and that's what's highlighted on your slide. A credible allegation can come from any number of sources, including the state's integrated monitoring activities, data reviews, grant reviews, stakeholder calls, media reports, and so on. Thinking through each of these examples of how a state could become aware of this information, those examples associated with state-run activities such as monitoring, data reviews, and grant reviews may seem a bit clearer to identify since these would be directly related to an established system. However, it is equally as important to ensure that the latter part of those examples are also included in your state systems. As we move through the next few slides, we'll talk about some considerations your state may use as you work through this concept. Lastly, and as a reminder, OSEP does not define what allegations are deemed credible. This is part of what would be included in the state's policies and procedures, which leads us directly into the next slide, please. Shoshana. Okay, so here we're going to take a look at the concept of a credible allegation and expand upon it further by looking at how it impacts a state's practice. So question B2 of the guidance takes this concept and outlines the state's responsibility once it is made aware of an area of concern. This is where the state's policies, procedures, and practices are critical to the overall general supervision system. So starting at the top, we'll work through this flow chart. So number one, state is made aware of an area of concern. When a state is made aware of a concern or a potential area of concern, the first step, and something that should be clearly described in the state's policies and procedures, is determining if the information received is credible. Having this as a documented initial step in the process ensures that all staff involved can follow the same procedure each time. Additionally, and as discussed on the previous slide and in question B1, credible allegations may come from any number of sources, and having it handled in the same manner ensures consistency. Your state may have a general help desk that receives calls, or an ombudsman or an ombudsperson that assists when stakeholders report concerns regarding special education practices or compliance with IDEA. Regardless of the manner in which a concern is brought forth, having a mechanism for tracking all reports and allegations that are reported or that the state becomes aware of is part of a robust general supervision system. As we look to the next step in this flowchart, and for the sake of today's presentation, we will assume that the concern reported to the state in this example is credible, which then leads us to the second step. The state implements policies, procedures, and practices. Here is where we really focus on the policies, procedures, and practices the state has in place to consider and address in a timely manner, address the concern in a timely manner. This includes what we already discussed, those written policies and procedures that describe the process for determining if a concern is credible, ensuring that it is completed in a timely manner. From there, what are the policies, procedures, and practices within the general supervision system that explain how the concern will be addressed in a timely manner? Is there a timeline specified in the state's policy? If a concern is deemed credible in October, what is the reasonable timeline for which the state will initiate and conduct its due diligence? This leads us right into the next step, number 3. State conducts due diligence and reaches a conclusion. The information included in question B2 is clear. The state must conduct its due diligence to address the area of concern in a reasonable amount of time and reach a conclusion. This can be done in a variety of ways, and the guidance provides a few examples of activities related to due diligence. These include conducting clarifying legal research, conducting interviews with staff, parents of children with disabilities themselves, and groups that represent families and communities served by the LEA or EIS program or provider, and reviewing and analyzing data and information. Question B3 addresses the type and amount of information this review. While IDEA is not specific on this, the OMB uniform guidance requires grantees to maintain effective controls that provide a reasonable assurance of compliance with federal statutes and regulations. This means that states must have internal policies and procedures in place to ensure compliance with IDEA. As part of its general supervision system, the state should be able to explain the methodology used to ensure that the type and amount of data reviewed accurately reflect the LEA's or EIS program's level of compliance. The type of information reviewed may vary depending on the specific requirement, but could include data collected as part of a state's data system, information contained in the early intervention record of an infant or toddler with a disability, or the education record of a child with a disability, interviews conducted with relevant staff, parents, and others, as well as a review of LEA or EIS program or provider written policies, procedures, and practices. That takes us right into number 4. The state determines if an LEA or EIS program is in compliance with IDEA. So this is the last step for the state to reach a conclusion regarding the area of concern and then to make that determination. If the state concludes that the LEA or EIS program is out of compliance with an applicable IDEA regulation, the state must issue a timely written notification of noncompliance. Timely in this situation, as with the identification of noncompliance, is generally within 3 months of the state exercising due diligence and reaching a conclusion that the LEA or EIS program or provider has violated an IDEA requirement. Here, you'll see that the asterisk signals that a written finding would not be required if the LEA or EIS program or provider immediately corrects the noncompliance prior to the state issuing the finding, and the state is able to verify the correction following the same requirements in B11 and B12. Next slide, please. So we recognize that determining if an allegation is credible can be multifaceted and complex. There are nuances in any scenario that we could possibly discuss. So here are some questions that you might want to consider as you review this guidance related to your general supervision system and the development of your policies, procedures, and practices. As discussed on the previous slide, the important piece to remember is how you, as the state, implement a process that outlines your responsibility for how to handle allegations that are brought to your attention. The two overarching questions that you want to be sure you can answer are specifically related to those policies, procedures, and practices. Your policies and procedures, as described on the previous slide, should guide the practices your state takes when a credible allegation is received. So not only should you have these policies and procedures in writing, but they should also be utilized in practice. Again, this ensures that all staff, regardless of who is made aware of the concern, can take the appropriate action based on the appropriate written procedure. As we move to the next slide, you will see some more specific questions that may be helpful to think through related to specific aspects of your policies, procedures, and practices. Okay, so here are more considerations, particularly as you think about how your state operates and handles allegations, because we know that everyone is a little bit different. So first, how does the state determine through policies, procedures, and practices the extent media attention meets the threshold of a credible allegation? So here's where this is going to be very specific to each state, and your policies and procedures should describe what this threshold is. Is it based on the number of media reports, the intensity or depth of the media report, how many parents or children are involved in the media report? So really thinking through all of those scenarios. Next, how does the state analyze current and historical information regarding concerns to identify trends? This goes back to thinking through the mechanism you use to track all of the concerns that are brought to your attention. Regardless of whether or not it becomes a credible allegation, you may want to think through how all concerns are tracked in the event something that was previously deemed not credible now has new concerns brought forth that make it a true area of concern. Next, what data are reviewed when conducting due diligence? Question B3 gives some specific examples of data, but what data are specific to your state? Are these data sources documented in your written procedures? So again, thinking through some specific examples. And lastly, how are multiple data sources used to reach a conclusion? Think of this one similar to how you think about triangulating data. If a media report was how you were made aware of the information, what special education data are reviewed? Are IFSP or IEP reviews necessary? Are interviews with parents or providers needed? Regardless of sources used, the state should ensure that the information reviewed is representative of the population served within the LEA or EIS program to ensure validity and reliability. Regardless of your state's response to each of these considerations, it is critical that everything is documented so that all staff can implement the same procedure. Continue to work with your OSEP-funded technical assistance centers on reviewing and/or developing your state's policies and procedures. Your OSEP state lead can also support you in working with your DMS team in preparation for monitoring activities. With that, I will now turn things over to Kim to discuss the next section.
Great. Thank you so much, Shannon. And thank you all for joining us today. So today I'm going to be sharing with you some information related to Section C of the guidance, which focuses on state performance plans and the annual performance report, or the SPP APR. And as you know, OSEP views the SPP APR as a tool for transparency, reflection, and growth. And we do know that state staff invest a significant amount of time to ensure that the SPP APR clearly communicates to the public how children with disabilities are faring within each indicator. We also know that the SPP APR is an opportunity for states to reflect on their own performance and to consider areas for future improvement or focus. And it's really with this lens, this idea of using the SPP APR as a tool for transparency, reflection, and growth, that I am pleased to share with you a broad overview of how the general supervision guidance will be further integrated into the SPP APR process. Next slide, thank you. So as I mentioned, Section C of the guidance addresses IDEA's general supervision requirements that are reflected in the SPP APR. We only have a short time together today, so I will only highlight a few of these topics, but of course, you can go back and read the Section C in its entirety. So first, we wanted to highlight for you that a state should include a description of its general supervision system components in the introduction to the SPP APR. This really is a state's opportunity to describe for all stakeholders reading the SPP APR how its system is designed to improve results for infants, toddlers, children, and youth with disabilities, and to ensure that SEAs, LEAs, lead agencies, EIS programs, and providers are meeting IDEA's requirements. Additionally, Section C provides some clarity regarding how OSEP distinguishes between choosing state monitoring from state database as the data source for compliance indicators. So specifically, the guidance explains that when state monitoring is chosen as the data source for compliance indicators, OSEP intends for those data to be gathered during a state's integrated monitoring activities of LEAs or EIS programs or providers. When OSEP refers to a database or a data system, we are referring to an electronic system for collecting, maintaining, and storing LEA or EIS program or provider data. Section C also addresses specific information related to how states should report on the identification and timely correction of noncompliance in the SPP APR. So specifically, the guidance explains that states must describe in sufficient detail its process for ensuring child-specific and systemic noncompliance has been corrected. So while much of this information will be familiar to you, questions C3, C4, and C5 do provide greater detail regarding how verification of noncompliance and any continuing noncompliance is reported. These questions provide suggestions for how, hang on one second. These provide suggestions for information regarding how states may want to include these different, okay, so again, while the questions in C3, C4, and C5 will be familiar to you, these questions do provide greater detail regarding how verification of noncompliance and any continuing noncompliance is reported. These questions provide suggestions for information that states may want to include in their descriptions, including the time period covered by the subsequent data reviewed, how many records were reviewed, any trainings that were provided, and how the state determined that these specific actions demonstrated correction. Additionally, for continuing noncompliance, states must provide information regarding the nature of the noncompliance, actions taken to support LEAs or EIS programs or providers in achieving compliance. And this can be done through reviewing policies, practices, procedures, providing technical assistance, or any training that occurred, as well as any enforcement actions that were taken. So question C6 highlights how race and ethnicity are included in the review of data and other information in the SPP APR indicators. As you know, in Part B, indicators 4B, 9, and 10 all address race and ethnicity in the areas of suspension and expulsion and disproportionate representation, respectively. In addition, indicators 8 and 14 require states to examine representativeness in the areas of parent involvement and post-school outcomes. In Part C, indicator 4 requires states to analyze the extent to which the demographics of the families who responded are representative of the demographics of infants and toddlers receiving Part C services. And additionally, we did want to flag that the last paragraph in question C6 does include more detailed information regarding stakeholder engagement, and really encourages states to identify trends or patterns related to equity, including equitable access to Part C and Part B services. Lastly, Section C addresses public reporting requirements in the SPP APR, including how to report on states that have LEAs or EIS programs or providers that serve low numbers of children with disabilities. In addition, question C11 does encourage states to maintain the state's SPP APR on the state's website for the duration of the 6-year SPP APR cycle. So that's a very, very high overview of Section C, but really I do want to end where I started this section, which is that at OSEP, we do view the SPP APR as a tool for public transparency and really a way to reflect on progress that's being made and areas of need so that we can focus on improving outcomes and growth for children with disabilities. So another key part of this process are LEA and EIS program determinations, which I will briefly review next. So next slide, please, Shoshana. Thank you. So Section D of the guidance addresses state determinations of LEAs and EIS programs. And as you know, a comprehensive determinations process can be one way to recognize programs that are meeting IDEA requirements and are successfully improving outcomes for children with disabilities. They can also be a way to drive improvement by identifying areas of need. And so importantly, while IDEA does not require a state to make annual determinations of LEAs or EIS programs available to the public, OSEP does encourage states to do so in an effort to promote accountability and transparency. So to put it simply, a comprehensive determinations process is critical to having a reasonably designed general supervision system. Next slide, please. Thank you. So in Section D, you'll find information that describes the requirements for the local annual determinations process. For example, question D1 reminds us that states must use the same 4 determinations categories that OSEP is required to use with states. So that is first meets requirements, also needs assistance, needs intervention, or needs substantial intervention. Question D2 reminds us that states must consider 4 factors in its determinations process. First, looking at performance on compliance indicators. Second, looking at valid and reliable and timely data. Third, looking at correction of identified noncompliance. And fourth, reviewing other data about the LEA or EIS programs compliance with IDEA, including relevant audit findings. So question D2 does encourage states to consider stakeholder input from a variety of constituencies, including parents, children with disabilities, LEAs or EIS programs or providers, local level staff, teachers, specialized instructional support personnel, 619 coordinators, and many others. And you can find that full list in question D2. Question D3 reminds us that the department has encouraged states to use results and functional outcomes data when making annual LEA or EIS program determinations. So again, this is a very high level overview of Section D. We encourage you to read the section in its entirety to make sure that you have all the information that has been provided. And with that, I will turn it over to Travis, who will discuss Section E of the guidance.
Great, thank you, Kim. So Section E is enforcement through determinations, and this section provides information on states' responsibilities related to enforcements. When we enforce the requirements of IDEA through determinations and other methods, we are building an accountability to our priorities and processes. And accountability is the glue that ties commitment to the result. Next slide, please. Once a state makes the annual determination for each LEA or EIS program, it is required to take certain enforcement actions if the determination is needs assistance for 2 or more consecutive years, needs intervention for 3 or more consecutive years, or needs substantial intervention. For needs assistance 2 or more consecutive years, the state must take at least one of 2 actions: either advise the LEA or EIS program of available sources of technical assistance that would address the area in which the program needs assistance and require them to work with appropriate sources of technical assistance. Or the state can identify the LEA or EIS program as a high-risk grantee and impose specific conditions on the grant award. For Part B, the state must prohibit the LEA from reducing its maintenance of effort for any fiscal year. If an LEA or EIS program is determined to be needs intervention for 3 or more consecutive years, the state may take any of the actions I just described and must either require the LEA or EIS program to develop a corrective action plan or improvement plan, or it can withhold whole or partial future payments, or it can do both. If an LEA or EIS program needs substantial intervention, then the state must withhold in whole or in part future payments. In any case, when a state is proposing to withhold payments, the state policies and procedures should clearly describe how any IDEA funds withheld will be managed. In Part B, the state must notify the LEA of the determination and provide reasonable notice as well as an opportunity for a hearing. In Part C, where the LEA contracts with EIS providers, the contracts are governed by state contract law and should clearly describe the actions the lead agency will take if the EIS provider fails to perform consistent with the terms of the contract, including compliance with the IDEA. Next slide, please. Other enforcement actions. So of course, states can use a variety of other enforcement actions to facilitate improved compliance, which might be especially helpful in situations when an extremely small LEA or EIS program does not have sufficient data to demonstrate systemic compliance. For example, some states have placed a state-level management team at the local level to develop and implement policies, procedures, and practices necessary to bring the agency into compliance. In this case, they might also include specific training, technical assistance, and/or coaching to support local staff in resuming operations and fading out direct state-level support. Under Part B, the SEA may even take over the direct provision of special education and related services if the LEA is unable to establish and maintain programs of FAPE. Again, a state system of progressive sanctions and enforcement provisions must be clearly described in policies and procedures. Next slide, please. We are working closely with many TA centers to develop resources and provide technical assistance to states to ensure that 8 components of a reasonably designed general supervision system are in place and clearly described in policies and procedures and consistently implemented across the state. Next slide. Finally, we would like to highlight the importance of technical assistance and the many supports available to states and entities. In the words of our Deputy Director, David Cantrell, this guidance is meant to help states and stakeholders reflect on and improve general supervision systems. OSEP is proud to invest in and partner with numerous technical assistance centers that provide relevant, concrete, and actionable resources and tools. Next slide. We want to include links to some supports and resources that you can access across our OSEP-funded TA centers. These resources can assist states to evaluate and operationalize their general supervision systems. We have listed the IDEA Department of Education page, the Early Childhood Technical Assistance Center, the IDEA Data Center, the Center for IDEA Early Childhood Data Systems, the Center for Appropriate Dispute Resolution and Special Education. Next slide. Our OSEP-funded TA centers also host various training meetings and conversations about the guidance. As you can see here, the Center for IDEA Fiscal Reporting and the National Center for Systemic Improvement will be hosting an open door session to review the fiscal implications of the general supervision guidance within a state system. Next slide, and I'll turn it over to Kate and Matt, who will manage questions both in the chat and during this time. Thank you.
Thank you so much, Travis and team. I will also just highlight that we will be at Cadre, we'll be presenting at DEC. We've been participating in lots of great conversations and fireside chats with many of you to help think through many of the questions that you have. So we're hoping to continue to support you as you're grappling with and have questions around how to operationalize our guidance. So I think, oh, and we'll also be at CASE. Those are the next 3 coming up, and we'll be talking with Cadre and meeting with our OSEP funded TA centers for further work on additional resources. I don't see any questions in the chat right now, so this would be a time if states have any questions. We do appreciate the many questions that we've been receiving, the different scenarios to talk through and assist states in developing and thinking about their processes. So continue to bring those forward to your state leads. They're always your first point of contact. They will ensure that that information gets to our team. If you'd like to contact us directly, here are our emails and our contact information. We're happy to take those questions. Again, they're helping us build our presentations, our conference presentations. We hope we'll be able to work through some scenarios and think through the different questions that we've been getting in a slightly more interactive fashion. So we hope that that will be helpful to you as well. So seeing no questions, I will go ahead and close the call for today. Thank you so much for participating. This will be posted on the website after this presentation, along with the PowerPoint that we've used today. Yep, and Shoshana just put in the chat the Ideas That Work website. That's where they will be posted by tomorrow. So thank you.
And Kate, could I just mention that we do have a second TA call in October that will be in 2 weeks, Thursday, October 26th at 4 o'clock, as we usually hold them. And it will provide a walkthrough of recently released IDEA Part B DMS monitoring reports. So during this call, OSEP staff will highlight key common findings that were outlined in the reports and provide guidance on specific components of general soup, like those you've been hearing today. So please mark that on your calendar for Thursday, October 26th. And I think with that, we will go ahead and thank you all for participating today and close out the call.